The periodic paralysis specialist that I saw, Dr. Jareth, noted, she mentioned that she sees patients that have been diagnosed with functional neurologic disorder all the time. Like, it's so common. And some of them end up having periodic paralysis. And I know that in my functional neurological disorders support groups, there have been quite a few people that have left the group saying that they have been misdiagnosed and they end up having something like a brain tumor. Not to scare anybody with FND, you can truly have FND in my understanding, but that's kind of concerning to me, like from the standpoint of it seems like FND and PP could be so easily confused for each other. And it makes me wonder if patients that have been diagnosed with functional neurological disorder should be screened for periodic paralysis as well. And I know that for some people that's going to be kind of a strange question because the diagnostic criteria for FND in and of itself states that all other possible reasons for the symptoms need to be ruled out before FND is diagnosed, but many doctors are not very knowledgeable about periodic paralysis and they don't have patients that have periodic paralysis, so they're not familiar with the like very fine nuances of it. And so there's also a lot of misinformation out there about periodic paralysis. And so to me, it stands to reason that if somebody doesn't feel, like in my case, I didn't feel that I was adequately evaluated for periodic paralysis, and I've heard that over and over again in support groups. And while I do think it is possible to have both conditions, I just wonder if there should be some kind of other screening to help patients, especially those who might not be aware of periodic paralysis and who might actually be put at higher risk. And the reason that I say higher risk is because once you're diagnosed with functional neurological disorder, one of the main things that they tell you is don't try to study your symptoms. Don't try to identify triggers because it'll make your symptoms worse. If you want to learn more about that, you can through resources like FND Hope. My concern would be like patients with periodic paralysis might not have identified their triggers. I am very fortunate that the way that I came across periodic paralysis was because I had a very severe attack of weakness after using an asthma inhaler. And thinking that it might be related to Ehlers-Danlos syndrome, I just typed into Google Ehlers-Danlos syndrome muscle weakness inhalers, and periodic paralysis came up as a search result for that. So I felt very fortunate that I started tracking my symptoms and paying attention to the triggers early on. But for somebody that might come across FND first, or might be maybe their doctor tells them about FND before they know about periodic paralysis, and if that doctor is not familiar with periodic paralysis, they can get stuck in a place of, okay, they're diagnosed with FND, but then they're told not to track their symptoms or their triggers, when if they have something like periodic paralysis or another condition that's dependent on them identifying their triggers, then that can put them in a lot of danger. So people with periodic paralysis often have heart arrhythmias, especially in Anderson-to-Will syndrome, and people can actually go into cardiac arrest. A lot of people with ATS have implanted defibrillators or pacemakers, and they need regular cardiac workup to make sure that everything's okay. And you're not necessarily going to get that monitoring or that testing done if a doctor thinks that you have functional neurologic disorder. So that's something that really is concerning to me. Another thing is that respiratory failure can happen for people with periodic paralysis, for those that have very severe attacks, because the muscles responsible for breathing will become weak during an attack, and that can put them at risk. So you have this condition, and this is not to dismiss the severity of a condition like functional neurological disorder at all. I do think, as doctors are saying, it's really important for those patients to be identified early because it can be so debilitating. But I think it would be remiss if periodic paralysis wasn't thoroughly considered before that diagnosis, or at least at the same time as that diagnosis, because that could be a fatal consequence for that person that might have periodic paralysis. Patients that are experiencing a delay in receiving a periodic paralysis diagnosis can start to experience permanent muscle weakness. The potassium supplements not only help prevent episodes, but preventing the episodes of weakness actually helps prevent permanent weakness from happening in the future. And that can affect quality of life and mobility. So that's a big deal. But I think that maybe if we have more people aware of it, that's partly why I'm making these videos. The more people that know, the more people that'll be able to recognize it, the more likely patients will be able to recognize themselves, or doctors will be able to recognize if it is periodic paralysis. I was told that it's best to seek out like a nephrologist to rule out kidney disorders, a neurologist, and if possible, a neuromuscular specialist. I saw a neurologist and a neuromuscular specialist, and there was very little understanding of periodic paralysis, not to fault the doctors at all. I don't think they had that specific training, and they didn't have those patients, so how could they know? But it took going to a specialist in that specific area of periodic paralysis for me to be able to really feel assured that I was having a correct evaluation. My big picture question is, does it make sense for other physicians, maybe cardiologists, physical therapists, emergency room doctors, maybe even general practitioners, to have an understanding of periodic paralysis? I know that when I went to the ER and even suggested periodic paralysis, I was told, no, but you know, like, you looking into these kind of things, like this happens even to medical students, but you start to think that you have certain conditions. I was given that whole thing. And once I went to a specialist, they were like, yeah, I think this is possible that you have this. So I think there's a lot of misinformation out there, and I think it's so critical for the correct information to be out there. And if you happen to be a healthcare provider that wants to learn more about periodic paralysis, I highly, highly recommend the Periodic Paralysis Association website. They also have a fantastic YouTube channel that features the conferences and guest speakers who specialize in the area of periodic paralysis. If you've had experience with FND or periodic paralysis, or if you're a healthcare provider, I'd be so interested to hear your experiences, whether you learned about periodic paralysis or FND, or if you even have any patients that experience these. I'd be so interested to hear. So thanks for listening. If you have made it this far, congratulations. And I look forward to your comments, and I will see you guys soon.